Picture this: millions of people around the world living with a condition that affects not just their skin, but their overall well-being. This is the reality of psoriasis, a chronic disease affecting 2 to 3% of the global population. Psoriasis knows no boundaries, impacting people of all ages, ethnicities, and backgrounds. It's a condition that deserves our attention, understanding, and a commitment to finding effective solutions. The impact of psoriasis extends far beyond the surface of the skin. While the visible symptoms are apparent, the true burden runs much deeper. Behind every statistic, there's a human story of resilience and the pursuit of relief. Psoriasis is a global health concern, affecting millions worldwide. Psoriasis isn't just a skin condition, it's an autoimmune disease. The immune system mistakenly attacks healthy skin cells. This misfire leads to rapid skin cell production and inflammation. Understanding this helps in developing effective treatments. The skin's protective barrier is compromised, leading to thick, scaly plaques. These plaques commonly appear on elbows, knees, scalp, and lower back. Genetic predisposition and environmental triggers play significant roles. Managing these triggers is crucial for managing psoriasis. As a medical doctor, I've witnessed firsthand the impact psoriasis can have on individuals' lives. From the physical discomfort to the emotional toll, psoriasis is a condition that demands our attention and empathy. I'm here to provide you with accurate, evidence-based information about psoriasis, empowering you to make informed decisions about your health. While there is currently no cure for psoriasis, the good news is that there are many effective treatment options available to manage the condition and improve quality of life. From topical creams and ointments to light therapy and systemic medications, we have a range of tools at our disposal to target the symptoms of psoriasis and address the underlying immune system dysfunction. Working closely with your healthcare provider, you can develop a personalized treatment plan that meets your individual needs. Living with a chronic condition like psoriasis can be challenging, but it's important to remember that you're not alone. With the right knowledge, support, and medical care, you can live a full and active life despite psoriasis. By adopting a holistic approach that encompasses medical treatments, lifestyle modifications, and emotional well-being, you can take control of your health and strive for a brighter future. In this video series, we'll delve deeper into the world of psoriasis, exploring the different types, symptoms, and treatment options available. We'll also discuss the latest research and advancements in the field, offering hope for even more effective treatments in the future. Knowledge is power, and by understanding psoriasis, we can better navigate its challenges and live our lives to the fullest. Psoriasis is a master of disguise, often lurking beneath the surface before revealing itself in a variety of ways. While the specific symptoms can differ from person to person, there are some common telltale signs that can help us identify this enigmatic condition. Recognizing these signs is the first step towards seeking diagnosis and embarking on the journey towards effective management. One of the most distinctive features of psoriasis is the appearance of plaques raised, red patches of skin covered in silvery white scales. These plaques can vary in size from small coin-sized lesions to larger patches covering extensive areas of the body. The location of these plaques can also differ, with some individuals experiencing psoriasis primarily on their elbows and knees, while others may have it on their scalp, lower back, or even their nails. Beyond the plaques themselves, psoriasis often announces its presence through a symphony of uncomfortable sensations. Itching, perhaps the most common and bothersome symptom, can range from mild to severe, often disrupting sleep and impacting daily life. The affected skin may also feel dry, tight, and sensitive to the touch, adding to the overall discomfort. What sets psoriasis apart from other skin conditions is the accelerated rate of skin cell turnover. In healthy skin, cells grow and shed in a controlled cycle that takes about a month. However, in psoriasis, this process goes into overdrive, with new skin cells being produced at a much faster rate. This rapid turnover leads to the buildup of thick, scaly plaques, as the body struggles to shed the excess cells quickly enough. Psoriasis manifests in various forms, each with unique characteristics. Plaque psoriasis presents as raised, red patches with silvery white scales. Guttate psoriasis appears as small, drop-like lesions on the torso and limbs. Inverse psoriasis affects skin folds, causing smooth red patches. Pustular psoriasis is characterized by painful blisters filled with pus. Erythrodermic psoriasis causes widespread redness and inflammation. Identifying your psoriasis type is essential for effective treatment. The itch of psoriasis is more than just a minor annoyance. It's a relentless, often unbearable sensation that can dominate your thoughts, disrupt your sleep, and impact your quality of life. This persistent itch, often described as a deep burning or prickling sensation, is a hallmark symptom of psoriasis, adding another layer of complexity to this multifaceted condition. The root of this relentless itch lies in the complex interplay between the immune system and the nervous system. In psoriasis, the immune system's attack on healthy skin cells triggers the release of inflammatory chemicals called cytokines, which activate nerve endings in the skin. These activated nerve endings send signals to the brain, which interprets them as itch. The irony of the itch-scratch cycle is that while scratching may provide temporary relief, it ultimately exacerbates the problem. Scratching damages the skin's protective barrier, allowing more irritants and allergens to penetrate, further triggering the inflammatory response and intensifying the itch. This vicious cycle can be incredibly frustrating and difficult to break. Managing the itch associated with psoriasis often requires a multi-pronged approach. Topical treatments, such as corticosteroids and calcineurin inhibitors, can help reduce inflammation and calm the itch. Cool compresses, oatmeal baths, and moisturizing lotions can also provide soothing relief. In some cases, your doctor may recommend oral antihistamines or other medications to help manage the itch. The vibrant red hues that often accompany psoriasis plaques are not merely a cosmetic concern. They are visual cues of the intense inflammatory battle raging beneath the skin's surface. This inflammation, a hallmark of the body's immune response, is a key driver of the discomfort, thickening, and scaling associated with this chronic condition. Imagine your immune system as a vigilant security force, always on high alert for potential threats. In psoriasis, this security force mistakenly identifies healthy skin cells as enemies, triggering a cascade of inflammatory events. Blood vessels in the affected area dilate, allowing immune cells and inflammatory mediators to flood the site, leading to the characteristic redness and swelling. At the heart of this inflammatory response lies a complex interplay of immune cells, chemical messengers, and signaling pathways. T cells, a type of white blood cell, play a central role in orchestrating the immune system's attack on the skin. These T cells release inflammatory cytokines such as TNF-alpha and IL-17, which further amplify the inflammatory cascade, leading to the proliferation of skin cells and the formation of psoriasis plaques. Understanding the inflammatory nature of psoriasis is crucial for developing effective treatment strategies. Many treatments aim to interrupt or modulate the inflammatory process, reducing redness, swelling, and other uncomfortable symptoms. Topical corticosteroids, for example, work by suppressing the immune response in the skin, while systemic medications, such as biologics, target specific inflammatory pathways involved in psoriasis. Psoriasis is more than a skin condition. It affects internal systems and organs. Its inflammatory nature can lead to cardiovascular diseases and metabolic syndrome. Systemic inflammation increases heart disease risk. Monitoring cardiovascular health is essential for severe psoriasis management. Understanding these connections is crucial for comprehensive care. Living with psoriasis can be profoundly challenging, not only physically, but also psychologically. The visibility of the condition often leads to stigma and social withdrawal, significantly impacting mental health. Patients frequently report feelings of embarrassment and frustration, which can escalate into more severe psychological issues, including depression and anxiety. The chronic, unpredictable nature of psoriasis flare-ups contributes to these emotional burdens, creating a cycle of stress and symptom exacerbation. The psychological impact of psoriasis is so significant that mental health care is considered an integral part of the treatment protocol for patients suffering from this condition. Depression in psoriasis patients is not merely a reaction to cosmetic concerns, but also a response to systemic inflammation. Inflammatory cytokines, known to be elevated in psoriasis, are believed to play a role in brain chemistry alterations that can predispose individuals to depression. Support groups and psychological counseling can be crucial in helping individuals cope with the emotional aspects of psoriasis. These resources provide a platform for sharing experiences and strategies for managing both the physical and emotional challenges of the disease. Additionally, cognitive behavioral therapy and other forms of psychological counseling can be effective in managing the stress and negative thought patterns that can exacerbate psoriasis. It is also essential for healthcare providers to routinely screen for mental health issues in patients with psoriasis. Early intervention can prevent more severe mental health problems and improve overall quality of life. By addressing the psychological as well as the physical aspects of psoriasis, a more holistic and effective management plan can be developed, emphasizing the patient's comprehensive well-being. Psoriatic arthritis, or PsA, affects up to 30% of psoriasis patients, causing joint pain and swelling. It can develop before skin symptoms, complicating diagnosis. PsA can affect any joint, often the fingers and toes, leading to significant disability if untreated. Early diagnosis and treatment are crucial to prevent long-term joint damage. Treatment involves medication and physical therapy, with advanced cases requiring biologics. Psoriasis treatment offers multiple options, from topical creams to systemic medications. Topical treatments are the first line for mild to moderate cases, reducing inflammation and scaling. Systemic treatments target the immune system for moderate to severe cases. Phototherapy uses UV light to slow skin cell growth. Lifestyle modifications, stress reduction, and support groups are also vital. Topical treatments are key for mild to moderate psoriasis. Corticosteroids reduce inflammation and are used for short periods. Vitamin D analogs slow skin cell growth. Coal tar and salicylic acid help with scaling and itching. Combining treatments can enhance effectiveness. Systemic therapies are essential for moderate to severe psoriasis. Biologics target specific immune components, offering high efficacy. Traditional medications like methotrexate suppress the immune system broadly. Oral small molecules provide targeted therapy. Choosing the right therapy involves considering severity, health status, and treatment goals. Lifestyle modifications are crucial in managing psoriasis. Stress reduction techniques like meditation and yoga can help. A balanced diet supports skin health. Regular exercise reduces stress and boosts overall well-being. Proper skincare and avoiding triggers prevent flare-ups. Psoriasis is a lifelong journey with periods of remission and flare-ups. Understanding triggers and developing strategies is key. A proactive approach with personalized treatment plans yields the best results. Keeping a symptom journal helps identify patterns. Support groups offer invaluable encouragement and advice. Psoriasis can impact other organs requiring regular monitoring. Psoriatic arthritis affects up to 30% of psoriasis patients. Cardiovascular disease is a potential complication. Monitoring blood pressure and cholesterol is essential. Metabolic syndrome is more common in psoriasis patients. Embrace a positive mindset and prioritize self-care. Strong social connections are essential. Stress management practices like meditation and yoga help. Educate yourself about psoriasis and treatment options. Communicate openly with your healthcare provider. Psoriasis doesn't have to define you. Research is evolving, offering hope for better treatments. Connect with others for support and share your story. Remember, you are stronger than you think. Embrace self-care and the richness of life.